Well, whenever there is a mass shooting, we often hear there needs to be better mental health care in the United States. Dr. Kevin Gilliland has 20 years of experience in clinical research and counseling. He joins us now to dig a little bit deeper into what needs to be done to improve mental health. Good morning, doctor. Thank you so much for being here.
It's good to be here with you guys.
You know, unfortunately, when we see these mass shootings, a lot of people will say, it's not a gun issue, it's a mental health issue. And I know it's a very political issue as well, but we have to acknowledge that there are some mental health issues at play here. If there was more money for the mental health industry, how would that play into it? What would it look like?
Yeah, and you're right, it's a both issue. It is a mental health issue, and it's also a gun issue. I think what it would look like is a little, if you think prevention, that's, I think, the place that we have a real opportunity to make an impact, which is most people verbalize an intent. It's much like suicide, which we see more frequent than we see these aggressive acting out. And people often will talk about it ahead of time, and I think our real challenge is how do we find sort of this cluster from a research standpoint of what are some of those symptoms that we see that may increase the risk significantly that someone's going to act on the statements they're making. Because people almost always make statements, little statements. It's either to friends, family, sometimes coworkers. And how do we intervene to start getting some treatment and help at that point? Does that make sense?
It does.
Yeah.
But so you hear those red flags, and you know, do we need more free access to mental health screenings, that kind of thing? I mean, if they're saying that to a mother or a teacher or someone like that, what gets them into your office? Yeah,
and that's where I think we have the biggest opportunity to do something different, which is how do we create a system where those people can notify the appropriate either authorities or healthcare people that can then step in and in a temporary way suspend or do as much as we can to prevent someone to access lethal means like that. And it's at that place that whether we get a better referral into both of those agencies, that's the thing that we've got to figure out. If we can suspend the political piece and figure out how do we get someone in, that's where we have an opportunity.
Okay. And, you know, it seems like a lot of times these red flags arise. They get into a psychologist or a psychotherapist's office, and then something still happens. So do we need to actually put them in, I don't want to say an institution, but put them in a facility where that's where they need to be for a while?
Yeah, it's one of the unfortunate things about all of this is that it's a low frequency incident.
Right.
It doesn't happen very often. And so
although it feels like it does.
It does. Well, and part of that is because we have so much access to information now that we didn't used to have. And when you look at people that are researching, it seems that these have taken a very different turn since the 90s. And a lot of that is now you can see either images or eyewitness reports of what's happened. And so we have this mistaken idea that mental health is the cause. And that's actually an error. There are some mental health issues, but mental health diagnoses like depression or anxiety or substances, those people aren't any more violent than the average population. It's when you start to see some other symptoms like a psychiatric admission that's involuntary, or a psychosis, or some agitation that's beyond anything you normally hear. And then you hear that statements about guns and violence. And the hard part is, like suicide, a lot of people verbalize an intent or a wish not to be alive. A small number actually act on it. But we have to treat everything, even if it's someone mentioning it in passing. We have to treat that seriously, and we do that. We do a pretty good job on suicide. We don't do a good job on homicide and aggressive behavior. And I think if we can mirror some of that, then we have a chance. But it's very hard for us to predict behavior. It's really difficult. I do some legal work at Innovation 360 for substances, and it takes probably 3 to 4 weeks to do a really thorough evaluation to see if someone has a substance use disorder. You've got to talk to a lot of people, you got to review a lot of records. It's very time consuming.
Sure.
But if we're looking at treatment on some symptoms, we have a better opportunity to do that. And locking people up is actually going to miss where we really need to get to.
The takeaway being that we all need to be listening and take everything seriously.
Yes.
Doctor, thank you so much for your insight. What a large topic to tackle this morning.
Goodness.
Thank
And
you
so
for your
emotional.
time.
I
Yeah,
know.
absolutely. When we come back, Amber will be here with a quick look at our forecast.